from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about managing your medications mindfully. Our guest today is Brett Lambert, a clinical pharmaceutical care specialist with the Transitions of Care program at Sarasota Memorial. Brett, thank you so much for being with us today.
Thanks for having me.
Transitions of Care, for those who don't know, is all about helping people transition from the hospital setting to care at home. So how important is managing medication as a part of that?
Yeah, so managing medications or medication management, there's quite a few steps in this process. And so being mindful of all those steps, whether it's making sure you're having all of your medications, making sure you pick them up from the pharmacy, whether it's a new fill or a refill, making sure that you understand the labels on those medications, making sure you understand how these medications are dosed, making sure you measure out your dose appropriately for some of those liquid medications, storage of these medications, being adherent to these medications, and following any supplemental instructions with these medications are all vital to making sure that you're managing your medications appropriately. Now, I know that's a lot of steps that I just said.
Yeah.
And so bringing up the transitioning from the hospital or to the hospital adds another wrinkle into that situation, right? And so it's found that an average nationwide, some studies have identified that 7 to 8 medication discrepancies are identified on each admission medication reconciliation during these hospital stays. Now, if you include those 7 steps I just said and that 7 to 8 medication error or discrepancy average, when patients go home from the hospital, that means they potentially have anywhere from 49 to 56 errors that they have to be mindful of every day while managing their medications. And so finding ways to minimize those errors, whether it's having a pattern that's repeated or vigilantly checking all of those boxes, make sure everything is taken care of to help minimize those risks of being readmitted.
So we're going to go into some of those steps today because they're so important. What are some of the questions you recommend patients ask their providers about new medications they're being prescribed?
Yeah, another great question. So as far as anytime you get a new medication, you want to make sure that you clarify what exactly you're taking. So you need to make sure you understand how you're taking that medication. An example of this would be if the prescriber says you're going to take 2 tablets once a day. Well, you might interpret that as I'm going to take 2 tablets every morning. You might also interpret that as taking 2 tablets at night, or you could interpret it as 1 tablet in the morning, 1 tablet at night, 1 tablet every 12 hours. All of those are valid interpretations of those directions, but you may need to specify with the provider and clarify how exactly you should be taking this medication. Another tip I like to advise patients to ask their providers when they're being prescribed new medications is what to expect from this medication. How is it going to impact the disease state that it is being used to treat? And furthermore, finding specifically what should the patient be finding when taking this medication. Is it going to reduce their blood sugar, leading to less frequent blurry vision, less frequent headaches, less frequently going to the bathroom? Or are there maybe side effects of this medication possibly being you might experience more headaches with this medication, you might experience sexual dysfunction with this medication. So really identifying what those side effects might be so that way the patient can know going into this therapy what to expect.
What are questions that should be asked of pharmacists specifically? Because they're different questions than you would ask the provider who's writing the prescription.
Right. Yeah. So as far as asking the pharmacist specifically, I would ask them about general side effects of the medication. What are the most common side effects that may be seen? And if there's any alarming side effects that the patient needs to be made aware of. That's just the tip of the iceberg, really. From there, I recommend clarifying any missed dose instructions. So if you are to miss a dose on the certain medications, it's common to just say, go ahead and skip that dose and follow up with the next dose. Other medications might say if it's before the first half of your dosing interval, go ahead, take that dose. And then when it's time for your normal dose, go ahead and take that. However, some medications, such as blood thinners, are a little bit more particular about their missed dose instructions. So please identify what those missed dose instructions are. Lastly, storage of medication can be very important for integrity of the product. A lot of tablets and capsules are okay to be stored at room temperature, but if you have a liquid, maybe specify or maybe ask the pharmacist if it needs to be stored in a refrigerator, in a cool area, or anything like that, because you want to make sure that medication stays stable throughout your course of therapy. So that way you're, one, not wasting money on buying a product that's expired, and two, making sure that it's going to help you out.
Great points. What is the number one concern when patients transition home and are managing their meds? Because I know you brought up a number of discrepancies that can happen, but what's really the number one concern?
Yeah, I think finding the number one concern is very patient specific, and it's going to depend on what disease states were treated while the patient was hospitalized, as well as what disease states they're managing at home. However, if I had to summarize one issue that commonly can be found is keeping track of your medication list, making sure that the information you have is accurate, up to date, any changes that were made during the hospitalization or any changes that maybe weren't supposed to be made but are identified, looking at that and identifying what those discrepancies are. That way, whenever you follow up with your provider at your follow-up visit, especially if you were admitted to a hospital, you should be seeing your provider a week to 2 weeks after being discharged. And if you have those questions ready, you can clarify, hey, provider, I think I noticed that this medication is a injectable anticoagulant that they were giving me in-house. It somehow ended up on my list. Is this something I need to continue taking? And then your outpatient provider can clarify that whether that's appropriate or not to continue taking that. That way you're clarifying your list, making sure it's accurate, up to date, and minimizing any errors that could contribute to being readmitted.
And we're going to talk about the importance of that medication list in just a little bit, but are there any tools you recommend to help patients remember their medications each day? Because I know you mentioned that is a big concern. People miss doses or forget to take certain medications. How do you recommend people keep top of mind and don't miss their important medications?
Yeah, so this is something where I review with patients every time I meet them every week. I'll look at their list of medications and I see a list of 12, 15, 30 medications. And I think to myself, oh my gosh, this is overwhelming even for me. It doesn't matter who it is. If you have 30 medications you're keeping track of, that's going to be challenging. And so the best way to do it is to try to simplify it into a strategy that can be scaled up to however many medications you might have. So the best tools that I can recommend is utilizing a pill tray. So those Saturday through Sunday little trays where it has each day of the week, and then you pick a day of the week and you fill up all of your medications for that day of the week. They have these in multiple variations. Sometimes it's just one little capsule or one little compartment for each day of the week. Others have a morning, a night. Some even have a four little prongs saying AM, noon, PM, evening, right? They have different times. So figuring out which one of those is the best for you, I recommend you getting that and following through with that. Another benefit of this is that it reminds you when you're ready for a refill. So that's also a great tool to help remind you need a refill, as well as reminding you to take your medications each day. The other tool I'd recommend, this one is a little bit more, we'll say ancient, not necessarily ancient in the terms of real life, but maybe in the terms of medicine, is using those alarms. So you can use alarms on your phone, which are very helpful tools to use. Alarms on your watch, those also remind you. But what's found to be best at improving adherence is actually a physical alarm clock. So located somewhere in your house, that way whenever it goes off, it forces you to get up, no matter how much you don't want to. It forces you to get up, go all the way across your house, and then turn it off, and then you store your medications right next to that, so that way it reminds you, oh yeah, I need to take my medications today.
Because it's an important question that you recommend people ask their pharmacist, what should someone do if they do miss a dose? They have their tray, they go back, oh my goodness, I forgot to take my noon med, or whatever that is. What should they do?
Perfect. I love this question. As I kind of alluded to earlier, all of your medications are going to be a little bit different, right? And so clarifying that with your pharmacist is going to be the best option for you. Generally speaking, most medications, as long as they're taken within the first half of that dosing window. So let's say you normally take your medications at 8 a.m. and it's 10:30 and you realized you forgot to take your medication. It's okay to go ahead and take that medication at that time and then just pick up on your normal dosing schedule. Say it's something where it's a once daily medication that you normally take at 8 a.m. and all of a sudden it's 3 or 5 p.m. because you had a doctor's appointment this morning, you went and got lunch with your friends afterwards, and then you come back and then it's 3 or 4 o'clock. As long as it's a once daily medication and it's not a blood thinner or anything like that, generally speaking, it's okay to go and take that medication at 3 p.m. as long as it is within the first half of your dosing window. By dosing window, I mean if your dose is once every day, that's a 24-hour dosing window. So the first 12 hours of that is the first half of your dosing window. Other medications, such as something like a blood thinner, you may need to be more cautious with this because we never want you to double dose on any of your medications, especially your blood thinners. So please be sure to clarify that information. Other medications, such as inhalers or insulins, those typically, if you do realize that you missed a dose, go ahead and take it as soon as you realize it. But please clarify with your provider before you make that decision.
Good points. What should a patient do if they feel they no longer need a medication, whether it be because their symptoms have improved, if it was a temporary medication, or they don't like a medication's side effects? How do you recommend they have that conversation?
Oh yeah, I get this question all the time. Like I said, when I'm looking at patients list who have 30 medications, they say, how can I get rid of some of these medications? I don't think I need some of these medications. The first thing I always advise patients to do is to talk with their provider about the medication in question to see if it's something that they still need to take. Let's say it's an over-the-counter vitamin or supplement that you started taking on your own. If you're not seeing any benefit from it, it's likely okay for you to stop whenever you feel you don't need it anymore. However, if it's something prescribed, clarify with your provider what it's being used for and see if it's something that you can stop that medication. So let's say you're taking an antibiotic and you find you're already feeling better. I completely recommend completing that course of therapy, right? It's a 2-week course, but on day 6, you're feeling better. It's recommended you go ahead and complete that therapy. I know it might be a little bit more frustrating to take that medication a little bit longer, but the full 14 days of therapy is found to be more beneficial than just that 6th day where you're starting to feel significantly better.
So if a patient has clarified with their provider and they no longer need to continue a medication for whatever reason, how should they properly dispose of that medication? Because that's a huge issue. So if they no longer need it, what's the proper way to get rid of it?
Yeah, I go home every now and then and I look at my parents' medicine cabinet and I find medications that are still sitting there from 2008. And I tell them all the time, I'm like, you need to dispose of these appropriately, right? And I tell them they have a pharmacist as a son who can walk them through those steps. So it's funny because every area is a little bit different. So my family's back home in Louisiana and their resources are a little bit different than what we have here in Florida. Specifically to our area in Sarasota, you can actually go to the Sarasota Police Department and they have a drug disposal box where you're able to pour all of your medications in. It's anonymous. They don't keep track of you or anything like that. You can put controlled medications, not controlled medications, any prescription drug medications. They can be disposed 7 days of the week from 6 a.m. to 6 p.m. and you can dispose your medications that way. Another great tool that is actually nationwide is the DEA has what's known as a drug take-back day. And what they do is they partner up with community pharmacies all throughout the country. This past year, it was April 27th. Typically, it does take place in late April. But what they do is they send either a DEA or a local police department officer to the pharmacy to collect any medications that were brought back from the community to be disposed of. So that way there's one day a year where you can just bring your bag of medications, they'll dump them out into a box that they'll take back and dispose of appropriately. The last tip is for, let's say, a patient who can't get out the house or maybe might be a little more challenging to go to the police department because of how far away it might be. This option is for those who can really stay at home. It is okay to dispose of medications in the trash. However, there's a couple steps you need to take first. That being to put the medication in something that is a non-desirable substance. So either coffee grinds or kitty litter or anything like that, pour that into a Ziploc bag or just a resealable plastic bag with your medications in there and then dispose of that in the trash. Now, this does vary depending on the dosage form you have, right? If it's a tablet or a capsule, that's perfectly okay to do that. However, if it's a patch, this might not be the best option just because of how that medication is formulated. There's also the theory of flushing some of your medications. I know this one can be kind of questionable on some people depending on who you ask. There is a do not flush list though of medications that you should avoid flushing down the toilet. And so I recommend anyone who wishes to dispose of medications at home, go to the DEA's website. They have a list of how to properly dispose of your medications at home.
Very good points. What should a patient do if they notice their medication is expired, or they go to the pharmacy and they find out it's been discontinued or is currently unavailable due to shortage, whatever it may be? What should they do?
Right. So if it's an expired medication, I don't advise patients taking any expired medications, not because of potentially not having a therapeutic effect, but also it might have harmful side effects that are more noticeable at this point in time because it is expired. So I recommend, if it's an expired medication, dispose of it in any of those means that we just talked about. As far as if a medication is discontinued by a provider, what to do there. So if you go to the pharmacy and you're told that it's discontinued, be sure to reach out to the provider to verify that this medication is discontinued and that they want you to stop taking that medication. Once it is verified, I advise you go ahead and take it off of your drug list that you should hopefully be having on you at all times, as well as updating quite frequently.
So if someone is prescribed multiple medications by different providers, which we see happen quite a bit, what are some of the biggest concerns you see as a pharmacist?
Yeah, so I like to describe this as, what if there's more than one person steering a ship? It might be hard figuring out what direction we're going in, and each captain might have a different theory as to what they're doing. So if you do have multiple prescribers prescribing medications for you, always be sure to get everybody up to speed at every single visit. So having that list of medications that I mentioned earlier, keeping it up to date, keeping it as accurate as possible, and sharing that with your providers as frequently as possible is a great way to keep track that everyone is aware of the same information.
What do you recommend when it comes to patients advocating for themselves and making sure their providers know they're on different medications, have different ailments aside from what that provider is treating?
Yeah, so much like having that medication list, you also want to have maybe a list of disease states that you have. So that way, every single visit during the first parts of your visit at any provider's office, there should be either a nurse or an MA or someone coming to kind of ask you some basic questions. At that time, please address all of those changes. And I recommend you repeat that information to the provider as well anytime there's a change occurring, right? If the provider says we're not making any changes this visit, still let them know, hey, I also started taking this medication, just so that way they are aware of that.
So if there are contraindications, a patient is sitting with a provider who says, oh, that medication you're on this list, I need to prescribe you this, but there's a problem with it. How can they talk to those providers about what is most important to treat and when? Because that provider might say, I want to pull you off that other medication. Do you recommend they circle back to the provider who prescribed that? How should a patient advocate for themselves in that situation?
Yeah, so I think that question comes up all the time, and a recent example of where this kind of fits in is for treatment of COVID-19. A common medication used is Paxlovid. Well, a lot of patients are prescribed statin therapy for management of their cholesterol levels. Well, some statins do have interactions with Paxlovid, and they're not recommended to be taken together. However, a simple fix is to hold the statin for a couple of days while taking Paxlovid, and then you don't have to worry about that interaction, and it will not overall impact the treatment that the patient is receiving for both their cholesterol and for their acute illness. However, for longer term medications, I recommend communicating and coordinating with both providers. So whoever originally prescribed the medication that might have a contraindication, speak with them about finding an alternative therapy that would work better with the new therapy. Your new provider prescribing the medication will hopefully take that into account as well, and maybe they have an alternative therapy option that they can prescribe, so that way it does not interfere with any of your current medications.
Points. How can patients discuss alternatives if a prescribed medication, beyond just contraindications or any other concerns, if they find out a prescription is just too expensive?
Mm-hmm. Yeah, so going to a pharmacy, this is another area where they can catch maybe potentially some contraindications or some drug-drug interactions. And oftentimes the retail pharmacy, the community pharmacy that you go to, will have to contact your provider about those interactions that might be occurring. And so because of that, they will have access to alternative options. And so when there's an alternative available, whether it be through guidelines recommending an alternative therapy, the pharmacy will typically try to reach out about that. Now, when it comes to cost, this gets a little bit more hairy, so to speak. The pharmacy will receive the order for the medication, and then if the patient has insurance, they'll run it on the insurance. Insurances do have preferred formularies of medications that they will cover, and if the medication prescribed is not on there, oftentimes it will link to an alternative for the pharmacist to be given that information, so that way they can reach out to the provider and say, hey, this is the alternative that is covered on the patient's formulary. Would you like to prescribe this as an alternative?
Some patients also go to multiple pharmacies to fill different medications based on cost, availability, convenience, whatever it may be. How should patients talk to these different pharmacists about all the different medications they're taking and make sure that a provider hasn't missed a contraindication?
Yeah, another great question, right? Everyone is trying to save a buck any way they can these days, and using different pharmacies is definitely a way to do that. However, like you said, it brings up the question of how do I keep everybody informed of my care? So keeping that medication list accurate and up to date before you go to pick up a medication, even if the pharmacy has it ready and to be filled, see if the pharmacist is able to review that list of medications compared to what they have within their system. That way they can have an accurate list of everything to perform any drug-drug interaction checks, as well as seeing if there's anything they can identify that might need to be changed before you pick up that therapy. So before you take the medication from the pharmacy, please give them the list of medications just to have them review it, just to make sure everything is safe.
Makes a lot of sense. I know we've covered a lot of different things and tips and tricks and things people can do and ways patients can advocate for themselves, but are there any other safety tips or tricks you recommend when it comes to managing medications at home?
Yeah, so the last thought I'd like to leave everyone with is that managing your medications is not always an easy task. And then, especially if you have more than a handful of medications, this can be very tiresome and very tedious. So what I highly encourage patients do is reach out to any healthcare providers, any healthcare team members, family members, friends, neighbors, or anyone that you trust to really be able to help you with this. Especially as patients get older and medications start to pile up with more and more medications, and it seems like every other week there's a new medication on the market. So asking for help is what I recommend to help get through all of these changes. I like to almost compare the medication management steps to building an IKEA furniture, right? So when you first get that IKEA furniture, you get the box and you're all excited and you're really motivated to put it together. And then you open it up and then you set up all of your pieces, just like you have all your medications out in front of you. And then you might feel a little overwhelmed. You then look at the instructions and you begin to read them and you're like, I don't understand anything that is listed here. You then try to find all the pieces you need and realize, oh, I don't have all of the tools. So you can try to put it all together yourself, but if you're missing something, then that might lead to, say, a desk that it has the shelves where the drawers need to be and vice versa. And then the moment you need it is the moment that it falls apart. The same thing can be said about our bodies with these medications. And so what's best to do is if you have any questions or if you're ever concerned about it, reach out either to ITA Help Desk or your provider's office or your pharmacist, so that way they get you on track, as well as asking for help from friends, right? Because building things is much easier when you have help doing so.
Absolutely. Brett Lambert, thank you so much for joining us today.
Thanks for having me. It's been a pleasure.
As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.